much, Dr. Clannon. This information, of course, is extremely valuable and was very thorough. And we, again, applaud you, as I stated earlier, for all of the great work that you and your team have been doing in terms of being thoughtful, intentional in how to roll out this plan. And I want to also acknowledge and thank you for really focusing in on equity as well and being transparent about it. So thank you so much. I know that we have a number of questions in the chat, so I'm going to do my best to get through as many as I can. To the extent that there are questions that we don't go over today, we will put the information slide back up so that individuals know how to reach out to follow up with any follow-up questions. So let's see, our first question I see here is asking, what happens if a patient gets the Johnson & Johnson vaccination and then later says they want Moderna?
Well, number one, if we knew that they had already gotten the vaccination, we'd say no, because there's not enough to go around for everybody. And then number two, there's no reason to believe it would be dangerous for people to mix vaccines. But like I said, we're trying to stay within the science, and nobody tested that. Each of these vaccines was tested alone. So we don't really know. There'd be no reason to believe it'd be dangerous, but we don't recommend that people do that. And for sure, if someone got Johnson & Johnson and then wanted another one, we would say, no, you already got vaccinated, as long as it's still in short supply.
Yes, thank you. Another question, and I'm not certain if you have this information. It appears as though there's folks joining us from San Francisco wanting to know if there's information about the timelines as clearly as we've articulated in our presentation that could be available for San Francisco. Any reference to their timelines that you have available?
I'm sorry, Chelsea, I got distracted by the chat, which happens sometimes. I'm gonna try not to look at it.
Oh, no. So the question was, do we have, or do you have information related to how the timeline will roll out in San Francisco? It appears as though we're joined by friends in San Francisco who's curious to know where they could get that information.
Because technically, we are going out of order, taking people out of tier. People, they may not be widely advertised that is happening, but I do believe I have some information that that they have been vaccinating in shelters in San Francisco. So I would encourage you to get in touch with the person that I connect with is Dr. Deborah Bourne. Deb Bourne, it's B-O-R-N-E, within San Francisco DPH. But there may be other folks also who'd be able to tell you.
Great. Another question: how do you monitor vaccinations at Santa Rita Jail when delivering 2-dose vaccines?
So the health contractor, which is called WellPass at Santa Rita, they are administering the vaccine, and they are moving through people based on, they kind of prioritized incarcerated people based on people in higher risk, either because of their physical conditions or because they're in some of the housing at Santa Rita is more conducive to spreading virus than others. So they went first to the people who were most at risk. And it is challenging. So far, we haven't had anybody leave before they got their second dose, but we're just new doing this. And as I think people know, sometimes that people are going to be there for a long time, but a lot of times nobody knows when they might suddenly be discharged. So we know that's going to happen, and we have a pathway worked out with WellPath to be able to offer, so they know how to offer people appointments at our community pods if they're leaving and they're halfway through.
Excellent. How can we coordinate vaccine for safer ground programs that have not yet received the vaccine?
So safer ground. So my understanding was that we actually had been offered in each of the safer ground, at least ones that are under Alameda County. I wonder if maybe these might be places either under City of Berkeley. They're their own jurisdiction, and so if it's a safer ground that's in City of Berkeley, it would be by talking to City of Berkeley. I'm not sure. Maybe the person who wrote that may want to clarify where they mean.
Okay. Well, I'll keep looking here. Another question, can we transport individual vials? Can't find definitive information one way or the other.
Temperature is the temperature is the problem, and so transporting an individual vial, the temperature, and then also jiggling. It's kind of a delicate. The little mRNA is kind of a delicate molecule, and so they don't want you to like shake it up in the car. So generally, when we transport vaccine, we have actually an enormous freezer that the doses go into. It's not ultra, it's not, the super low, but it's like a giant esky. It weighs 85 pounds, and it has a thermometer, an electronic thermometer inside that can show us that it never got above or below, the temperature range. So when you take a single vial out and you're transporting it around, you see all the different bad things that could happen to that vaccine. So on the other hand, we need to get to people. So the way this is being handled in other locations, couple of ways. One is we need the ice cream truck approach, which means that actually there's a vehicle that has, a refrigerator in it that can preserve the vaccine and go from place to place. So the ice cream truck model, the federal government is using now FEMA. They have a FEMA FEMA trailer that is equipped. That's the ice cream truck model, which is where you bring the refrigerator with you. That's kind of unwieldy to go to an encampment. I'm not exactly sure how it would work. And then the other one is that we do what's referred to, unfortunately, as a strike team. That's just vaccine language, but where we would have a pod, let's say Alameda, or there's a pod at St. Vincent de Paul. And we draw up, 6 syringes worth, and we go straight to, a nearby encampment. We know that it's carefully preserved, and we administer it at that location, within a time span of about an hour. And, that's technically a little, because we can't guarantee that it was in the appropriate temperature range. These are all kind of the subtleties, but we know that is how our neighbors are doing it, primarily, going to people who are homebound or who are living in curbside communities.
Excellent. This question asks, are there any incentives being offered for those who receive vaccines, like gift cards or needed supplies? I guess this requestor is trying to figure out, are we doing anything to try to encourage and incentivize folks to get the vaccine?
We have not been doing that.
Yeah. Let's see. Is it accurate that individual unsheltered people can't sign up on their own for appointments right now? Vaccines will only be administered through mobile outreach to encampments.
It is not accurate. So individual people experiencing homelessness, if they're over 65 or they meet one of those other criteria, they're working, in food, ag, restaurant. They're taking care of somebody. There are multiple ways they might be eligible based on on those other criteria, right? But if not, then there may, although we have told all of our vaccinating partners that we are vaccinating people experiencing homelessness, what we find is 2 things. How do people struggle a little bit with how do we know what's the documentation that somebody's homeless, and then the problem of ID. Is that people are required to show an ID with a picture on it that that has an address in Alameda County, and those are both, I think, people will experience those as barriers. But if someone does have a computer, or access to somebody working with them who has a computer, they absolutely can go to any of the Alameda County pods.
This question pertains to one of your earlier slides explaining the difference between the Moderna and the Pfizer vaccination. This question asks, do they contain the same ingredients? And I do believe you went over that earlier, but it'd be great to just refresh for those who joined a little late.
Yeah. So they don't. The what's in there is a little different, but the overall mechanism is the same. But it's a little bit different It's a little bit like Coke and Pepsi, same general idea, but not exactly the same ingredients.
Okay, all right. Let's see, it looks like there is a comment indicating that right now the vaccination site at St. Vincent de Paul is not carrying out a COVID vaccination site, or Alameda County is not. So I guess we'll put a pin in that.
Yeah, that was what was distracting me a minute. And I think what we might do is just ask Dave Motorsbach to unmute and tell us about that, because I want to make sure people have the right information.
Right.
Oh, we have to. I think we have to unmute him, I guess, huh?
Right. So Dorcas, you could work on that and just kind of give me a thumbs up when we're able to do that. Oh, here we go. All right, David, are you still with us?
Yeah.
Great.
Hey, David.
Hi, everybody. So sorry. This whole planning has been a very dynamic
That's true.
situation, to say the very least. Since Healthcare for the Homeless program is working with a variety of different ways that we're doing to set up our sites. Kathleen, that was last week's plan to start on the 4th at
Friday, though. It was
at
Friday.
St. Vincent's. And yeah, there's always something comes up. So we are not starting vaccinating on the 4th at St. Vincent's. We are starting at a different site. And I don't feel like it's really okay to announce publicly at that site, because it's kind of a soft start. But our basic approach is going to be setting up community care vaccination sites on an ongoing basis at places like St. Vincent's, the High Street area, and other places that have a high population of homeless people. And we're going to be there on a monthly basis. Give it the first shot, come back in a month, give the second shot, give the first shot to other people, et cetera, et cetera. That was originally planned to start on Thursday at St. Vincent's, and it's not. This Thursday is not going to happen at St. Vincent's, and of course we'll let our folks know when those community care ongoing testing vaccine sites start up. So sorry about that.
Thanks, David. Thank you. And that's part of why I did not actually share the calendar with people, because I know that that's also going to shift around. So thanks for that, David. I just want people to know, though, that it is starting this week. Actually, we've done some people already, but it is starting this week. And we're going to learn so much and figure out how to reach people.
Mm-hmm. Mm-hmm. Great. Another question. When you say there are 6 active encampment sites in Oakland and 47 have been closed, is that 47 figure referring to sites where there was once a COVID case?
David?
Dorcas?
I just turned him
Now
on.
I'm unmuted. Sorry.
Yeah.
Closed means that the rapid response was closed, not that the site was closed. When we consider a situation open, when we're following up, testing, and helping people quarantine or isolate in place. And as soon as that situation is done, everybody's clear, then we call that closed. We don't mean that the site is closed.
Thanks for the clarification. All right, we're rocking and rolling here again, everyone. We will try our best to get through as many questions as we can, but if there are leftover questions, we'll have information on how you can follow up. This question pertains to Albany, working with Berkeley Food and Housing, and in regards to outreach and housing for their unhoused, and indicating that individuals there are not in a shelter, but are transitionary and are transitionatory, excuse me. Are you working with the Berkeley Food and Housing program to vaccinate those folks?
The jurisdiction is complicated there because, again, City of Berkeley has its own health department and they get their own vaccine and they do their own vaccinating. But of course, City of Albany is part of Alameda County, and so so there's a little bit of a mix. So I don't actually know the answer to the question, but I can find out is what City of Berkeley is planning and whether we should have a joint operation there in the Albany area.
Okay, thank you. And we do know who posted that question, so we'll follow back up with her once we get that information.
Actually, Lucy Kasdan, who's on the line, says that she knows the answer. So this is our dexterity test for Dorcas, finding people quickly and unmuting them.
All right. Hi, good morning, everybody.
Great.
So Dorcas, you're so quick.
Yeah, it was fast. I was so we are going to be, street health, as Dr. Clayton mentioned earlier, so through our street health teams, we will be working on vaccinating unsheltered kind of across the county, which of course would include Albany. And then we are meeting weekly with the City of Berkeley on coordinating efforts, both in shelters and in unsheltered. So there's a lot of work happening in coordination with Berkeley specifically, and then of course working with other cities in North County.
Thank you. Thank you for jumping in here. All right, Dr. Clannon, another question in regards to your thoughts about the potential of a single dose Moderna as an alternative for the Johnson & Johnson shot. And this is coming from someone who apparently has some great insight here. She says preliminary data shows that the efficacy of single dose Moderna may be higher than a single dose Johnson & Johnson. And so questioning your thoughts on that. Uh-oh, hold on. Dorcas, is she unmuted? Or
nope, that was me, and I unmuted myself. I know that there's been a lot of excitement about that, the idea of single dose Moderna, and I do not approve. And I don't think, that all we have is the science that is there. No studies have been done using single dose Moderna. So we don't have any information really. Nothing was done that was designed to look at any kind of clinical endpoints around a single dose. So I think we need to stay inside the science until we really, have had a couple of years of experience with these vaccines. So, and that's also Dr. Moss, our health officer, his general approach also is that we do not recommend going out, coloring outside the lines of what those carefully designed studies have told us is true. It's, it may be that it'll turn out that that's good, but we don't know that, and we're not going to guess. This virus has just slapped us across the face a bunch of times over this past year where we made guesses that turned out not to be true. So we're done with that. We're going to move on to new kinds of mistakes, not the same old mistakes.
I hear you. Sounds good. Another question had to do with, I guess, throwing out a potential option, asking if the grocery stores, food service freezers would be potential storage places for the vaccination.
I'm just going to say no. They're medical grade. There are things that are called vaccine refrigerators and vaccine freezers, and they're medical grade. The main thing is they have to keep the material within a very, very narrow, band, and they, you have to actually, like when we're at a pod, there's somebody assigned to check the little thermometer once an hour and write down that, what temperature it is, that it never got above or below. So I think that that's not probably practical to use food refrigerators. Maybe they're super regulated that way also. I don't know that I know, but I think that's probably not really a very practical approach.
Mm-hmm. Okay. Of course, I'm certain this is something that a lot of our friends on the line are dealing with in terms of how do you combat rumors within our population. You touched on this earlier. Any thoughts you want to share and remind folks about in terms of communicating with folks and trying to encourage them to get the vaccine?
I have, there are 3 different approaches that I use when I'm talking to my, my patients, the patients that I see. And I think this is something that every single one of you on the line is also, we're all going to be vaccine missionaries some kind of way or other. And you got to figure out what is the message that works for you. one thing is I ask people, you know, what their thoughts are about it, what they've heard. There certainly are a lot of concerns people have out there about, you know, I've heard lots of different things, lots of different, you know, kind of rumors from people. So just kind of listening to, you know, understand why that might be worrisome. Talking through how many people by now, many millions of people all around the world have gotten the vaccine. And then talking about, you know, if they have special concerns about the speed, which do seem to be something that gives a lot of people pause. And then what I tell people is, don't make a decision, don't say no, say not yet. And then think through, what would it take for you? Would it be to know 10 people who've gotten it and seem to be fine? What would be the thing for you to say that you feel confident enough to come in to safety? And then the last thing is talking with people about, you know, in your life, does it make sense maybe not to get vaccinated for you, but to get vaccinated for other people? So, you know, get vaccinated for your grandmother that you want to be able to go see, get vaccinated for, you know, the other people who live with you or live nearby you. And sometimes that just reminding people that this is a way we're all keeping each other safe, in addition to, you know, to making sure that we ourselves don't have severe COVID. Mm-hmm. But I think we're all going to be learning from each other and from, you know, from people we're talking to about what will help them to make a decision that they feel comfortable with.
Mm-hmm. Excellent pointers and reminders. There's a question in regards to where do people go to sign up for appointments online as it pertains to homeless folks trying to sign up, or people experiencing homelessness trying to sign up for the vaccination?
So people can go to the Alameda County website. When we're done with questions, we'll put, Dorcas, if we can put the slides back up, the last slide has the link, but let's wait until the last couple minutes. Mm-hmm. So the Alameda County website has a place where you can put in a request to be vaccinated, and then we just periodically harvest the new people who've put on there, and then we go through them, figure out who's, you know, good for which site, and then send electronic invitations for them.
Mm-hmm. This is another question kind of tied to the question a second ago in regards to people who might respond negatively to the Johnson & Johnson vaccination, feeling like it's a second-class vaccine option. And a number of folks wanted to hear, again, your thoughts on how you explain why one might want to consider going ahead and getting the Johnson & Johnson shot.
I think what I would say is remind people, to me, that there's great evidence that vaccine protects you, that vaccine in a single shot, very effective at preventing you from getting sick enough to go in the hospital. And certainly there were no deaths in the people who got the vaccine in a big trial. So I think that's one thing. Then, you know, and so like, how do you compare it then, you know, to how do you, you know, kind of look at the risk benefits is a little complicated. So what I would say to people is, you know, if you think you're not going to be able to get back and get a second dose, that you don't know where you're going to be, you think there's going to be some new barrier, then I would encourage you to get the Johnson & Johnson vaccine. If you think that, you know, 3 weeks from now or 4 weeks from now, you're pretty sure that you know where you're going to be, then you have a choice, and it's okay to pick either one. Reasonable people could pick either one based on the evidence we have. You can tell that I don't have my patter down about that yet. It was just approved on Friday, and I'm still trying to think through how to talk to people about this. So I'm interested in how all of you will think about it also. Mm-hmm. So as far as we've gotten, Chelsea, is that as the county, we're saying we don't feel comfortable picking groups of people and saying we're only going to offer you the Johnson & Johnson. That as opposed to with all the other vaccines where we don't give people a choice, we give people what we have. That we are going to figure out how to manage to make people an offer of both.
I think that's excellent. Question in regards to, do you know how Alameda County is really enforcing the prioritization? What is the county doing for people who are jumping the line?
Oh, God. This has been such a drag. So this is one of the phenomena that has to do with, the state pushes an electronic tool for making appointments. First one was called PrepMod, and now they have My Turn. And they allow you to forward a live link to everybody and your brother. And as the links for appointments get shared, then, the qualifying information, like you got to be a teacher, you got to be, over 65, all that falls away and people just get a link. And then they follow the link and they can make an appointment. So they're like,
wow.
I guess it's okay. And so that's been a problem at the Coliseum and other places also. So we actually have a system now that you can't forward live links, and it allows us to do what's called geofencing, a word that I just learned, meaning, like we can only allow people who live in a certain zip code to make an appointment. But they have told us now that as of March 31st, we're going to have to give that up and go to My Turn, which allows, which does not allow geofencing. So it's been a major hassle. And then as we move into, occupational groups like food, ag, restaurant, with healthcare workers, most of them have some kind of, way to prove, that they work at a place, but not true of everybody who works, in those industries. So there's also been some tension about, how do we ask people to prove? Just like, how do we ask people to prove they're homeless? Like, what is the documentation? And so there's been tension between not wanting to have the barrier be so low that it's easy for people to lie and get the vaccine. But on the other hand, not wanting to have the barrier so high that it blocks out people who really should be getting the vaccine. So what we do now is we require people to attest. If you get an appointment online, you have to say, under penalty of perjury, plus, like major bad karma, that you are not lying and that you actually are in this group.
Yeah.
And then we ask people again when they come to the site, and we have big signs up. There were times when we were actually questioning people and asking them to produce, documents, and we have at this point stopped doing that because it just is a slippery slope of going down the eyeball test role. Like you look too well dressed to me to be a restaurant worker or whatever, wherever, and it just is unsustainable. So in the end, we're not police. We're trying to get vaccine into people's arms. We're happy to embarrass people, but we're not going to, we're going to ask them to follow their own conscience. And we know some of the time that means that inappropriate people are going to get vaccinated. I have to say it makes me really unhappy when that happens. There's some kind of culture that if you scam and get an appointment this way, that you have won somehow. And people are like, I got a vaccine even though I'm not in tier. I think it really makes me angry. It is not winning to shove your way in front of people who actually are at risk of death or hospitalization from this illness. It is not winning.
Agreed. A question in regards to the identification requirements. There's a question in regards to the mobile clinics at the encampments. Will you have to have an ID if you're at the encampment? And if so, is there going to be some organized effort to help individuals get identifications who are there?
So the reason why the ID is an issue is because for the vaccinating partners, the pharmacies, they get paid by billing the federal government for administering the vaccine, and they have to have something to be able to bill against. So right now we're working with them around whether the county can be sort of payer of last resort if people don't have any ID. And trying to figure out if there's a way for us to backstop them that way. But that's the nature of the dilemma at encampments, because people are there, we're gonna know whether they are actually residents of the encampment. It's more of a problem when people go to, make an appointment and go to a pod, go to a place where there's a mixed group of people. There, everybody else is gonna be having to show an ID. And so if people don't have an ID, we have to have some other mechanism for identifying that they are okay and in tier, and we're working on that. It is a challenge.
ties into a question about HMIS. And we're winding down. You have been going on a nonstop marathon here. So thank you so much. This is, I think we're winding down with the last question and a half. Are you using the HMIS system or the Clarity or community health record to track vaccinations amongst people who are experiencing homelessness? And then the half question, I think you already showed that the county does have an intention to demonstrate and show how the vaccination rollout has occurred for those experiencing homelessness. If you could just assure people in terms of how that information will be made public.
So we will put it, we'll answer the second one first. We will put that information on our vaccine dashboard on our website. And so what was the other one was?
The tracking mechanism. Will you be using HMIS?
Oh, HMIS. That's a hard question. Mostly it's medical providers that are doing the vaccination, so they know, and the medical providers are mostly not HMIS users. So there is a system, it has to go into a system that's called CARE, and which is the California Immunization Registry. We're trying to figure out a way to go back into CARE and capture that and bring it in, to a system that's visible to everybody. I don't know if we're going to be able to do that. So I think the problem is HMIS users are not going to know that it happened, unless unless the client can tell them, and the people who know that it happened are not HMIS users. So trying to figure that out.
Got it. Well, there's a lot of moving pieces. So thank you so much, Dr. Clannon. This has been extremely informative. I want us, Dorcas, to please go back to the information slide that was shared. At the same time, I'm going to encourage you all to follow and continue to engage with everyone home. Our information will be added in the chat box. So we encourage you to keep in touch with us as we continue to work hand in hand. Let's go one slide back, because I think if there are any follow-up questions, I want to ensure that individuals know where they can get information. Thank you again, Dr. Clannon. Thank you to everyone who joined us today and continue to do the efforts that you do. We greatly appreciate you, and looking forward to getting to a place where we're all safe and able to see each other in person again soon. So thank you so much, Dr. Clannon. And thank you, everyone.